Welcome back. In this second part of the presentation, we're going to focus on health information systems, but particularly on the issue of data quality. We're first going to define the concept of a health information system, as well as the concept of data quality. We will also describe how data quality is monitored and assessed, and we will identify and describe the different dimensions of data quality. What do you think we need to consider to ensure that data collected by a health information system is of good quality? First of all, what do you think makes something good quality? What elements do we consider around quality that makes it good? And how can we relate this to how we collect data within a health information system? Let's start by defining what a health information system is. And we're going to look at the WHO definition. The WHO defines a health information system as a system that integrates data collection, processing, reporting, and use of information necessary for improving health service effectiveness and efficiency through better management at all levels of a health service. A lot of the ideas that we see here, we see mirrored in other concepts we've discussed on this course. The data has to be used effectively and efficiently, and of course, we need to use our health information system to work towards improving the health service. Health information systems provide the underpinnings for decision making, and there are four key functions. First of all, we have to generate that data. We have to have systems in place to collect data. Once we've collected that data, we have to compile it together. And once we have a collection of data, it needs to be analyzed and synthesized so that it starts to make sense as information. And once we have interrogated that information through a knowledge base, we need to communicate that information and use it to improve our health system. So health information systems collect data from the health sector, but they also collect data from other relevant sectors because we see that health is involved in all sectors. What it does then is analyze that data to ensure that their overall quality, relevance, and timeliness is there, and to convert that data into information specifically for health-related decision making. So at the start of the module, we asked the question, why is it important to collect information about health? And we see that there are a number of uses for collecting data within the health information system. First of all, it provides us with a holistic picture of the diseases that are affecting our communities. We're also able to see the effectiveness of the treatment protocols that we put in place to address these diseases, both current treatment protocols and perhaps anything that is new. So if we think about the COVID-19 pandemic, there are new protocols that have been developed, and we have to see how effective are they in achieving their outcomes. Let's think it also helps us to assess the effectiveness of management plans that have been put in place when we have new protocols that require different resources. So we might have different levels of training, different people that need to be involved, different types of medication that have to be procured. And by looking at these different data points, we can get a better picture of our management of the health system. It helps us to see whether we are making progress or whether there's any regression within health measures. Of course, we want to work towards quality improvement in our health system, but sometimes you can also see that things are affecting our health system negatively. It provides us with information for new program development. I've given the example of COVID-19, but as protocols change and as new treatments come out, we have to adjust our treatment protocols. And we also have a number of new programs that are developed at different points in time to respond to different needs. So let's think about national health insurance, for example. And this will result in a number of new programs. And if we have accurate information about the state of health within our health system, we can design programs appropriately. It helps us to prioritize resource allocation, such as drug procurement, human resources. Who do we need to be working where? Which levels of the health system, which provinces, so on and so forth. And it gives us an opportunity to innovate within our health system. So it's very important that we assess the data that we are collecting. We've got to start with the source of that data. We think about the different types of data that are collected, whether it's a patient data or facility level data or population level data. And we have to think, who is collecting that data, at what level is it being collected, and how was that data collected? So was it collected by hand and using paper, or was it input into an electronic database? These things are going to affect the quality of our data. When we think about quality, there are a number of dimensions, and we'll discuss this towards the end of this presentation. How accurate is that the data that's being collected? How quickly are we using this information? Is the data being collected consistently? Or are there problems with the way that the data is being collected? And any data that we collect is only as helpful as what we do with it. So how useful is the data that we are collecting? Do the data elements collected give us the information that we need to make decisions? With reference to the sources of data, we have to ask ourselves a few questions. Who's collecting the data? Where is the data being collected? And what tools are we using to collect that data? So with reference to who's collecting the data, we have to ask who's responsible for that data collection. If it's a professional nurse in a facility that's seeing many, many patients, this might affect how accurately they collect that information, especially if they're using a paper-based record that has a tick sheet where they're required to look down a long list of different options. When we look at where the data is collected, this could also impact how well we're collecting this data. So if we have a private hospital with very good electronic system that has a bunch of checks and balances, we might find that the data would be collected better than in a different facility, for example, in a primary healthcare setting, where we have a huge amount of patients coming through the door. And finally, we have to look at the tool that we're using, because sometimes the tools are unfriendly. And if the tool is not user-friendly, or if the elements within the tools keep changing, it makes it very hard for people to be accurate in the information that they're collecting. So the issue of data collection, collation, and verification can be a complex one. There could be accuracy issues with the data that's being collected, and there could also be issues with how that data is being compiled together, the collation of it. Finally, we have to make sure that if we are collecting data and putting it together, that there are measures to verify how well that data has been collected. And then what happens with that data in terms of its analysis and interpretation? How did the data flow to its final data file? How was it imported or exported? And what format does it present with? Do we have sufficient data to form graphs? What indicators are we collecting? And what elements of that data can we use? A simple technique that we use to check the quality of data are the 3 C's. We ask ourselves how correct the data is, how complete the data is, and how consistent the data is. And we do this by looking at the different dimensions of data quality. So there are 6 dimensions of data quality, and these dimensions relate to the 3 C's of correctness, completeness, and consistency. With reference to correctness, we can talk about data accuracy and validity. These terms are often used interchangeably, but valid data are considered accurate if they measure what we are intending to measure. With reference to completeness, we mean that no pieces of data are omitted from the data collection and reporting tool. The third dimension of quality is that of confidentiality. Clients are assured that their data will be maintained according to national or international standards for data collection. Can we also make sure that personal data is not disclosed inappropriately? And finally, that data in hard or electronic copy are treated with appropriate levels of security. The fourth dimension is that of integrity. When we collect data, we need to make sure that it's being used for the appropriate reason, so that data are protected from deliberate bias or manipulation for political or personal reasons. The fifth dimension is that of precision. This relates also to the idea of consistency. So the data have sufficient detail to satisfy the needs for which it's being collected. And finally, we talk about reliability and timeliness. With reference to reliability, that data generated by a program's information system are based on protocols that do not change according to who is using them. So there's consistency with how they're being used, and that the data are reliable because they are measured and collected consistently. Finally, with reference to timeliness, that data are up to date and current, and that information is available on time. If we think about COVID-19, it's very important that we are able to report on who's testing positive for COVID-19, and that we can get that information back to patients, but also report to different levels of government, right? Of course, if that data is manipulated, it can have disastrous consequences. And you will note that the information that's been collected about COVID-19 is maintained through confidentiality, and that we have to have a complete and accurate picture of what's being collected. This concludes the content for this session. But if you have any questions or queries about the content that we've discussed so far, please feel free to post in the weekly discussion forum.